started. I'm just going live to YouTube.
Okay. Good morning, everyone. My name is Deanna Diamore, Director of Health for the City of Norwalk. It is 8:03 on April 25th, 2023. I'm going to call the Board of Health meeting to order. Present, we have board members Janet Karpiak, Joan McNeil, Norman Weinberger, Ken Levine, and Terry Quell. And we also have staff members Teresa Argandesi and Aniela Fanyun present. So good morning, everyone. The first item on the agenda is the approval of the March 28th, 2023 meeting minutes. Do I have a motion?
I move.
I'll second.
Second by Joan. Any discussion on the minutes? Any changes? All right, hearing none, I'll call a vote. All those in favor say aye or raise their
Aye.
hands.
Aye.
Any opposed? Any abstentions? Okay, hearing none, all minutes are approved. Thank you, everyone. The next item on the agenda is the director's report. So I have a few updates. So we were successful in submitting our annual report for reaccreditation. So thank you very much to Aniela for leading that with the support of Megan and then several of the staff members. Part of that submission included a narrative related to continued advancement. So we selected one of the measures within domain 3 that was related to health equity and reducing health inequities. And we talked about some of the great work that's going on in the community health division related to this. And we also talked about, the city's establishment of the community services department and human services department and working with all the different, entities within that, as now we're part of that umbrella department and how that's really helped to advance health equity. So I thought that was a great thing to reflect on. And so that was great. We also talked about our work related to increasing access to COVID-19 vaccines. So there's a great narrative for that. And then we also reported on population health outcome data. And so with Brian on board, we're able to take a new look at what we had put together in the past and to revamp that and make some additional changes. And so we're taking a look at that data that we're reporting to FAB, and we're making sure that we're incorporating that within, the community health assessment. And then, we're thinking back of basically when we're looking at, we only could select up to 10 measures that we'd be reporting out to FAB every year. And so we picked a lot of the similar ones we have in the past, but we took a look at, again, about what our initiatives are, what we're doing for community health improvement, what our priorities are, and we made sure that we had a good representative sample of measures. So thank you again to the staff for that. We also are embarking on Aniela's, our project coordinator, and she's looking at our quality improvement efforts now that we're back from, now that we're moving beyond being in the public health emergency, how we can continue to get back to the formal quality improvement efforts. And so we're going to be embarking on a culture of quality assessment. And so in the past, we've worked with our quality improvement work group to get this done. And we're expanding it a little bit more to include our entire staff. So we'll be meeting as a full staff and asking our staff to reflect on our leadership's commitment to quality improvement, what our QI infrastructure looks like, how empowered they feel as employees to make changes and to make improvements, how we do with customer focus, what does our teamwork and collaboration look like, and are we embarking on continuous quality improvement and implementing formal QI methods in our quality improvement. So that's just something. We have a staff meeting scheduled in a couple of weeks, so we'll be going through that, and it'll be really interesting to see what the feedback is from staff and how we can identify where we need to improve and continue to advance towards that culture, that formal culture of quality improvement. Another thing I wanted to share is that we have an accepted offer for our front desk receptionist position. You may recall that Catalina is being promoted. She's going to be our new public health program associate. She'll be working really closely with me. And so our receptionist position, as you know, it's really important to be bilingual in English and Spanish. And so we're really fortunate we found somebody really great to fill that role, so that she should be starting soon. Also wanted to let you know that I spoke about some grants the last meeting. We also were notified of some changes that are being made to the Preventative Health and Human Services Block Grant. In the past, a certain dollar amount was designated to each local health department or a set of local health departments to advance work in a variety of areas where you can choose that would fit most best for your local community. And so the process has changed. Now there'll be an application for that funding, but the positive to this is there's the potential for applying for more funding to be able to do more. And so Teresa's going to be leading that effort for us and applying for that funding. So we'll be working on that over the next month. And those are my main highlights. Any questions? All right. Thanks, everyone. Next on the agenda is epidemiology updates. So Brian is out of the office right now, so I'm going to be just giving some quick highlights for everyone to share where we are. So I'm going to share my screen. Can everyone see the screen?
Yes, we can.
Okay, thank you. So this is showing for COVID-19 where we are with hospitalizations and the trends over time. And so this is, again, pulling from our data hub. As you can see, we've been seeing a continuous downtrend since January, since the peak. And so that downtrend is continuing. So right now, in the state of Connecticut, the total entire COVID hospitalizations are 88. And as you can see, breaking down by county, Fairfield County has 27. So we're continuing to see that downward trend with cases and a little bit of a plateau recently. I also wanted to point out the wastewater monitoring. So as you recall, case rates and test positivity were measures that we frequently used throughout the pandemic, but as we know, with so many at-home test kits and changes in the reporting, really the hospitalizations and the wastewater monitoring are some of our key measures that we're looking at now and moving forward. So the wastewater monitoring also is showing that similar trend that we're seeing in the hospitalizations, that continual downward trend. And this is what we're seeing for Fairfield County. So all good news for us. Also wanted to share the CDC community levels. As you can see, for the entire state of Connecticut, every county is in the low or in the green, which is great. The variance, as you can see, this is where we are in the United States. The variance is very similar to what was reported out last month. The predominant variant strain is XBB.1.5, so that continues. And also wanted to highlight flu. As you can see, the activity right now, we're seeing very minimal, low flu activity, which is also great news. This slide shows for the state of Connecticut for the percentage of emergency department visits for influenza-like illness. As you can see, we had hit a bit of a plateau the past few months, and we're seeing even more of a downward trend that we've seen. So these continue. Again, everything we're seeing right now is looking very good in terms of downward trends for both COVID and influenza-like illness. The last thing I just wanted to point out is ticks. So as we know, as the warmer gets warmer, as things are heating up, the potential for ticks. So we just, on our website, we have a lot of great information about how to protect yourself. So just wanted to point this out to remind everyone as they're going out, spending more time outside in this warmer weather. While we have less flu-like illness and less COVID, we will see more tick activity. So it's really important to protect oneself from tick-borne illnesses. So those were just the quick highlights I wanted to share. Does anybody have any questions? All right. Next on the agenda is COVID-19 updates. And so we really wanted to talk about, as the end of the public health emergency gets closer, really what does that mean? What are these updates? And so Teresa's here to give us some updates related to that. So Teresa, pass it to you.
Thank you, Deanna. Good morning, everybody. I did put one slide up so that I could try to stay on target. So I just want to make sure. Can you see my slide or are you seeing the note slides? Okay, great. So just real quickly, you may have been seeing information in the news about the public health emergency ending. It's scheduled to end on May 11th. It's important to note that the public health emergency is one of several federal declarations that over the last 3 years or so have allowed for flexibilities and additional resources during the pandemic. And so there are other federal and state changes that are happening around May 11th or maybe toward the end of the fiscal year in the summer. And so we're keeping an eye on all of these different changes. I'm going to talk a little bit about some of them now. And many of them are tied directly to the PHE, but others are just part of, kind of an overall transition into a new phase of COVID response. So the shortest way to summarize all this information is that it's we're collecting as much information, gathering as much information, and monitoring specifically potential cost and access barriers that will likely emerge as some of the flexibilities and extra resources sunset in the next couple of weeks and months. So importantly, we're working with our local partners, specifically our healthcare partners and a lot of our community service agencies to plan for and communicate changes to the public. So one of the biggest changes, well, I'll say the trend overall is that the COVID response and treatment is really moving to a medical model. So not necessarily as part of the public health emergency all the time, but over the course of the next few months, you're going to see vaccines and testing and treatment really being integrated into the everyday medical system. And so folks will be directed to their healthcare providers or to other healthcare offices to get some of the services that they may have been getting, in the community at a, non-traditional site. So that's great. It should be part of people's everyday healthcare. However, we want to be really careful of those people who aren't connected to healthcare, who maybe don't have insurance or don't have a medical home, to make sure that they are connected to as many resources as possible. So with that being said, one of the big changes that's happening as a result of the end of the public health emergency is that the Medicaid redetermination is restarting. And so I'm not sure if you're aware, but for the last 3 years, as part of the public health emergency, the typical annual redetermination for Medicaid, showing asking Medicaid recipients to determine that they're still eligible, was waived. And so there are many folks who are on Medicaid who have not had to attest for redetermination in 3 years. And so the big message that we're trying to get out to the community is to make sure that DSS has your updated contact information. So in those 3 years, if you've moved, if your situation has changed in some way, it's really important that DSS is able to get in touch with you. Connecticut estimates that about 400,000 people statewide are up for redetermination as a result of this process. The good news is it's not all going to happen at once. They're going to do it on a rolling basis over the course of a year. So something like 30,000 people or so, 30,000 recipients each month will get a notice for redetermination. And so it's just really important that folks have their contact information up to date with DSS so they can get that redetermination form, keep an eye out for it in the mail, and then return it when they get it so they can stay on Medicaid uninterrupted. And so we've spoken to the folks at Access Health Connecticut and the Department of Social Services, and they do believe that the vast majority of people will still be eligible, but they still do need to return that form to indicate that, that they're part of the redetermination process. And then for those whose situations have changed, their income has increased, there's other reasons why they might not be eligible for Medicaid. There are other programs in place like Connect CT that allows for folks to be on qualified health plans for free. And then also, of course, the marketplace where people may be able to shop for more affordable plans if they're not eligible for Medicaid anymore. So that's a big one because it really ties into all of these other things where we're going to be saying that, you know, your healthcare provider or your insurance company will be able to cover some of these things in the future. So we want to make sure that everyone is connected to any of the resources that are available to them. When it comes to tests, the prevailing theme is that a lot of the free tests, at-home test kits, those kinds of things are probably going to go by the wayside. If you have private insurance and you've been able to apply to get your 8 free tests per covered person per month, that requirement for insurance companies to cover those tests is going away. It's possible that insurance companies will continue to cover a certain amount of at-home tests. Maybe the way to procure them will be different, or the number that is available will be different. But important to note that if folks have been doing that through private insurance, that will probably be going away or changing in some way. And then also, my understanding is that the federal government is no longer going to be purchasing the large quantities of at-home test kits. So as soon as the federal stockpile of what's already been purchased is depleted, then those periodic USPS distributions where you can go online and request a certain number for your household, those will likely end as well. So what we've been advising people to do is if they have access to those covered private tests through their private insurance, you know, no need to stockpile tests since they do have an expiration date. But as we approach the May 11th deadline, they might want to think about making sure they get, you know, that last allocation of tests before the deadline runs out. Also, the health department has been working hard to acquire tests from the Department of Public Health at the state level and distribute those out to the community through our community partners and a lot of our in-person outreach activities that we have. In terms of PCR tests and the rapid tests that your healthcare provider may order, again, those will likely move to a traditional healthcare payment model. So insurance may continue to cover those if ordered by your physician, but we're not sure if there will be cost sharing involved and or if there'll be any kind of like limit on how many tests per month or per cycle you can get. So that's testing. Think if there's anything else for testing.
Teresa,
So
can I
again,
just jump in and
yeah.
say your team is doing a great job and the staff's doing a good job? I think, was it 7,600 tests like within the past month or so, like that
Yeah.
you've distributed?
Yeah. So we've reached out to community partners who, you know, who are interested in giving them out to constituents, to clients, to residents. And then the CAP team and our other community health staff bring test kits out into the community at all our events and try to hand them out and educate people about the expiration dates and where they can go to find where the extended dates are listed as well. So moving on to vaccines, again, this is, I'm going to sound like a broken record, but the move is really going to be to move vaccines into the traditional healthcare model. And, you know, you'll see it termed as commercializing the vaccines. And so there's a lot of questions around how much the vaccine will cost. My understanding is that they should be covered under the preventive care requirement as part of the Affordable Care Act. So along with all other routine vaccinations that should be free to the patient with no cost sharing if they have insurance. And so in addition, children would be able to access, if they don't have insurance, would be able to access COVID-19 vaccines through the Vaccines for Children program. So any providers that participate in VFC, including the health department, who are able to give free vaccines to children. And then there have been some developments around the federal government providing some programs or processes in place that would allow for vaccines to be acquired and given to folks, to adults who don't have insurance for free. So that's something that we're keeping an eye on, trying to determine what the details are on that and how we can make sure that in our local community, everyone has access to vaccines, especially as we approach the fall season where we're expecting to see a recommendation for a fall booster. Along those same lines, the CDC recently suggested that if folks are 65 and older, and it's been at least 4 months since their last bivalent booster, they're eligible to get another one. So we're encouraging folks, if that's something that they're interested in, to go ahead and do that before May 11th or before some of these other free resources sunset or expire. And so that's the main recommendation around that, is to make sure you're connected with your healthcare provider. And if you haven't gotten your bivalent booster yet, meaning you haven't gotten a dose since September of 2022, when the bivalents were released, then we recommend that you do that when you can. For treatments, Paxlovid and others, again, moving to a traditional healthcare model. So we're looking at where those treatments will be available, if it's possible to provide access for uninsured individuals and those not connected to a medical home. And then one other small item, and I bet Brian would be able to give us a better update on this, and we'll know more in the coming months. But there are some changes to requirements for labs and hospitals to report data to the state and federal government. And so there'll likely be some changes to metrics that we have, traditionally been using to monitor COVID activity throughout the community. It may just be a matter of changing those metrics a little bit, or changing the frequency of when we're able to see them updated. But we're keeping an eye on that and working with our state partners to make sure that we have as much access to data so that we can monitor and catch anything that may be emerging as we go. And I think those are most of the changes that I can see in terms of the end of the public health emergency and others.
Thank you so much, Teresa, for that really great update. Does anybody have any questions or discussions related to this?
This is Ken. I really think that was a great update, and that's going to be the redetermination for the Medicaid providers, Medicaid patients in the marketplace is just a huge issue. I mean, think about that: 30,000 a month need to reestablish that connection if they still can. I think there's a lot of people that will just, whether they're not ignoring, but miss the opportunity to be counted in those numbers that are moving forward. I think that anything we can do to educate the public on how to make sure they don't miss out on that opportunity. It's the Medicaid program in the state of Connecticut is a fabulous program and provides services for so many. And I would hate to see people who have qualified for that benefit not being used in an appropriate manner. I just anything we can do to help that process, I think, would be greatly appreciated.
Teresa, this is Joan. Very good presentation. I was in CVS last week, and the pharmacist told me to pick up my eight COVID kit because it's going away at the end of the month. So I think they are educating the public as well. So, yeah, so very good. Thank you.
Great to hear.
Thank you so much, Teresa.
Sure.
And our next item on the agenda is community health update. So another great presentation from Teresa coming your way.
Okay. I'm going to turn off my video just because it's a little spotty. So I just want to make sure that I don't freeze up on everybody. So I'll just move on to my next slide that looks very similar. Okay. So I just wanted to, Deanna asked me to provide some updates on some of the activities that the Community Health Division is working on. We're excited to let you all know that we've been very busy with some of our more traditional community health and health promotion programs. But I will say that what I'm going to talk about today is just it's not inclusive of everything we're doing. And so maybe I'll come back sometime soon for a part 2. So I can talk a little bit more. And then I know also that Megan has been providing updates for our CAP team and the outreach they're doing around COVID vaccine. And so I'm going to leave that to her the next time she does an update as well. So this is a focus on some of our other programs. Okay. So some of you may be familiar with some of the programs that we've been able to relaunch, expand a little bit, and then there's some new programs in here as well. So one of our flagship health promotion programs here at the health department is Norwalker. It's a community walking initiative that maps various routes throughout the city to encourage people to go for walks in their neighborhood. But it also, we also hold community walks where we encourage people to come out on a particular day at a particular time and walk with us. And then we're also doing a lot of work around walking infrastructure. So pedestrian infrastructure, we've been able to plant street trees, and we're hoping to help the Transportation, Mobility and Parking Division with some additional pedestrian safety measures in the coming months. Last year in summer 2022, we held 7 community walks with 31 participants there. And we're about to launch our Walking Wednesdays program next week. I'm looking at the calendar, May 3rd is next week. And so each Wednesday in May, we'll be at a different location using a different Norwalker map starting at 5:30 p.m. So we encourage members of the community, city employees, friends of the health department, and folks who just want to get out and meet some of their neighbors and other people to come walk with us. But before Walking Wednesdays begin, we will be doing a joint walk with the Norwalk Public Library this coming Saturday, weather permitting, to celebrate some of the history of the library and the first Norwalk librarian. And so there's a great new route, not one of our traditional Norwalker maps, but we've worked with the library and the GIS department for the city to map a route near the main branch of the public library. And there's a lot of great historical information that will be presented and included for folks who come walk this Saturday.
Yeah.
So that's Norwalker. And then Fit Kids is one of our fantastic programs that teaches nutrition and physical activity to kids. Right now, we're focused on the pre-K to 2nd grade age group. It relaunched in summer 2022, and starting then right up until now, we're at 12 different sites, or we have been at 12 different sites. That includes summer programs like Camp Ellie at Stepping Stones, after school programs at various elementary schools in Norwalk, and then also a couple preschools as well. At those 12 sites, we've reached about 190 kids. And at the end of the program, we do a survey with teachers and staff members to get their take on how much the kids are absorbing and whether they've met some of the learning objectives. And the rates vary at each site, but between 88 and 94% of teachers surveyed reported that the students reached a key learning objective in the program. So we're excited about that and continuing to expand it. A new program that we started last spring is called Know Your Numbers. It's a community health screening program. We go to pantries, churches. We've been to the shelter and some other locations where folks, we feel that maybe folks wouldn't have access to maybe a medical home. They may have some food security issues. And so we provide free screenings for blood pressure, blood sugar, BMI, and waist circumference. And we've partnered with Norwalk Community Health Center so that they were there at the screenings, at the vast majority of screenings, to connect people to a medical home if they indicate that they don't have one. And so since April 2022, when we launched this program, we've done 13 community screenings, reaching about 216 participants. Interestingly, about 29% of them had elevated A1C, 51% had elevated blood pressure, 31% reported having no health insurance, 28% reported having no medical home, and 33% reported being food insecure. And so folks are screened by clinicians, very often members of our emergency response team. And then they're counseled on their numbers. If there's an elevated number or something that's concerning, we make sure that we provide that information to them to take with them to their next doctor's appointment, and encourage them to go to the doctor. And then we provide them with some just in time kind of like health education counseling, and provide them with resources on lifestyle changes and other things that they can do to increase their health around these different measures. If they indicate that they don't have a doctor or they haven't been to the doctor in a long time, we can connect them with Nora Community Health Center and some of our other partners. And then we follow up with them a period of time after the screening to make sure that they followed up. Interestingly, we've also, worked on trying to get additional community resources and information about other community resources to folks. Many of them indicate being food insecure, but aren't connected to SNAP, for example. And so we try to provide them with information about where they can go to get food, where they can access more resources to enable them to stretch their grocery budget as well. So trying to provide those supports too. And then we have our Growing Gardens program. It's our summer gardening program at Fodor Farm, where we provide garden plots to families and then teach them how to grow their own fresh fruits and vegetables, and then incorporate them into their family's diet. And so it's very typically parents with children in Newark Public Schools who are eligible for free and reduced lunch. And in summer 2022, 9 families participated in the program, and 89% reported an improved overall diet quality based on a food log that they do at the beginning and end of the program. We work really closely with the UConn Extension, the FNEP program at UConn, to do a lot of the nutrition and the cooking demonstrations, and they've been a valuable partner with that as well. And then finally, I'll talk a little bit about our food access initiatives. So a few years back, we had a lot of health promotion work had focused on nutrition education, making sure that people understood nutrition guidelines and how to incorporate more fruits and vegetables into their diet, lean proteins, those kinds of things. And several years ago, we were able to expand that work to also include food insecurity. So recognizing that we're teaching folks about nutrition guidelines, but if they can't access healthy foods, or if they're stressed with their budget to access food, they're not going to be able to put those guidelines into practice. And so some of the work that we do around food access is a lot about providing information. We're not doing we're not doing direct service. We don't operate a pantry or anything like that. But we are bringing together a lot of the partners to make sure that as a community, we can strengthen food security for all residents. And so we have a monthly food provider food access meeting to discuss any emerging needs that the providers are noticing, any trends. And then we also bring in speakers from the state and from other agencies to talk about other resources that the food providers can access. The food provider guide, which is pictured here on the right, is a growing list of places where people can get food, can get meals. And then we've also, with Brian's help, have been able to map that information on a map so that people can locate, the places that are closest to them. That's updated quarterly, and it can be found at norwalkct.gov/meals. So we encourage all of our community partners to distribute that to folks who may be food insecure. We work a lot with End Hunger Connecticut to do trainings and provide information about SNAP, the Supplemental Nutrition Assistance Program. We provide materials and resources to really encourage people who are eligible to apply for that so they can get some additional money for their grocery budget. We've also developed a food security dashboard with the Fairfield University Center for Social Impact that maps a lot of the food security and related data measures throughout the community so that we can make sure that resources are being placed geographically throughout the city and in good places. And that has helped to inform a lot of our work as well. And then one timely initiative is the summer meals outreach and blitz. So as you may know, Newark Public Schools provides summer meals, breakfast and lunch for any children under the age of 18 throughout the summer months, usually starting in early July and ending sometime in August. During COVID, when a lot of the restrictions were waived and the procedures were a little bit more flexible, we saw a real increase in the number of people that were accessing summer meals, which was good to see, because it's a resource that is available to all the kids in Norwalk. And in the last year or so, you know, the protocols have changed and kind of gone back to how they were before COVID. And so we're really working this year with community providers and Norwalk Public Schools to get the word out about where people can get summer meals and what the eligibility criteria are, and just encouraging people to take advantage of this great resource. And so that's some of the things that we have going on in community health. And I'm happy, you know, if anyone has any questions, to see what I can answer.
Thank you, Teresa. Any questions?
It's an exhaustive list. That's an unbelievable amount of resources that the community gets, and I don't know if they know it.
Thanks, Ken. All right. Hearing no other discussion, we'll move to public participation. If there's anyone from the public who would like to speak, please raise your hand virtually. And I see we have Diane Lauricella. So Diane, you've been promoted. Can you please unmute and speak?
Good morning. I didn't know if you, Deanna, can you see me?
I cannot. I can't.
Okay. All right, I'll have to find out how that can change because I'm promoted. Okay, well, anyway, good morning. I had taken some time to get other things done in the morning, but I wanted to speak just briefly, starting with some praise. I was so pleased that the health department had a table at the Earth Day on the Green. And I visited the table. I had a table related to waste management and recycling. I was one of the organizers. I was very, very happy to see the health department there. And I visited the table, and I agree that the Norwalkers program is a great program. So I had a nice chat with the person that was there. And also, I'm so happy that the Growing Gardens program's continuing for those of you on this call. And I'm not sure how many commissioners are still on the call or maybe off camera, but I was part of a group of very brave citizens that actually saved Fodor Farm way back when Frank Esposito was the mayor. And I'm so happy that we have this garden program and food access issues. Be that said, I have also been on the record over the last 3 years since COVID hit, the pandemic. And I guess I just wanted at some point someone could answer my question. I remember recently that I think it's Dr. Juthani, the Connecticut Health Department commissioner, had given an interview, and also the CDC, both were stating, this is only like a month ago, maybe 2 months ago, that they would strongly recommend that when people are indoors, that they wear a good mask. Yet I've been finding in Norwalk, and I travel around a lot, I'm usually the only one that's wearing a mask, and or one of very few. And this has to do with public events, ShopRite, Stop and Shop, Walmart, places I go. There still are some people wearing the mask, but very few. And in the past, I have suggested that we find a way to simply use graphics to try to suggest to people that COVID is still a thing. In fact, there was no mention at this meeting about Arcturus, the new variant that seems to especially relate to children and pink eye, and it's an emerging data. So it's not pervasive, but it's coming. And I know that the work I do as an environmental consultant is trying to get people to understand in layman's terms these messy and often very, very complicated science and chemistry and all this stuff. So, because we know so many people aren't aware. So putting things in layman's terms are very important. And while I understand that the staff who has endured, 3 years plus of this COVID, the public and the staff, I can imagine, and the government have what is known as COVID burnout. Still, the health department needs to rise above and find new and creative ways to keep the public aware and safe so that they can make informed choices. And I'm happy to say I want the public to make informed choices, but I still do not believe this health department has stepped up, because I get around, and I'm very pleased that Teresa mentioned things are changing. So it's an opportunity to remind people how they can still get COVID. And I would love to see this health department in creative ways let people know about long COVID. It's a real thing. And I have several friends that have gotten COVID only in the last month. And also people, I'm sure we all know people with what they think is long COVID. If there's any way that someone could help me understand about that, in the earliest parts of COVID, I suggested that Deanna Diamore and Teresa and others considered having COVID ambassadors that would walk around our parks, because we know people were getting outside and walking in the parks, but people could then be reminded in gentle yet good ways about how COVID is different than the flu, and that there are different ways in the aerosol, especially, that you can still acquire it. So I still don't see any graphics in food stores or Walmart, just outside. I'm sure that the owners would let you do it. Of course, we don't want to scare people, but we still, since last I learned, and I don't think they retracted it, it is strongly recommended that masking be considered indoors. But if the public doesn't, they're not reminded and it's not explained to them, they will forget about it or think there's no problem, and then the COVID variants will continue. So this is and as Ken Lalim often asks about public education, I do think that the city needs to help this health department do a bigger and better job with creative outreach. They have difficulties with outreach on other issues in the city, but if you have to hire a risk communication person to help Teresa and Deanna, because it's not getting out, even though you do have these special events, and they were listed by Ms. Argondesi. We're a city of approaching 95 to 100,000 people, and we're just not getting out enough. And I've always thanked the staff for what they could do, but we need to do better. But if the city, the mayor and the council don't help you in ways that count, and I don't think it's happening now, we are going to, approaching the fall, have huge problems again. And while I know that we're expecting an uptick, let's not make the public have to suffer through COVID bouts within their family and having long COVID, just because we just didn't get around to putting something on News 12 on at least a weekly basis or daily basis, or putting maybe something on a traveling billboard around the town. There are many creative ways that are not expensive to let people understand the threat of COVID that is still happening in our community. And lastly, I just want to say, we have to do better with incentivizing people to report to our health department when they do a home test. That was a CDC fail big time, but then it trickled down to our state and our local health departments. A lot of the public, even though it said in tiny words, please report, we needed to really, I think, shout it out, say it louder and longer and more often, because that helps you all with your data and it helps Brian with the data. If we don't have the home test, which everyone shifted to, many people shifted to, then that's a problem. So I'm saying this because I haven't spoken in a while. I've been quite saddened and frustrated with my message. I still have the same message, but I do want to help. And I think I can help. And I hope that you will listen to some of my recordings and what I'm saying today. Thank you very much for all the work you all do.
Thank you, Ms. Laricella. Thanks for taking the time to speak today. All right, is there anyone else from the public who would like to speak? I don't see anybody under the attendees. All right, with that, it's 8:49. Do you have a motion to adjourn?
So moved.
All right, all in favor?
Aye.
All right, thank you, everyone. Go adjourn at 8:49.
Bye-bye. Thanks, everybody.
Have a great day.